Thank you and good evening, everyone. Thanks for joining us tonight. I know Monday nights aren't generally the best after a really busy day, but we really wanted to kick off with the first Zoom webinar for GP-CPCS. To begin with, I'm just going to go through some general housekeeping. So we will be recording this webinar, so it can be used as an online resource for anybody that's unable to attend tonight. Now that's really important, and you will see why as we start to go through the next slides. The videos will be often muted because this is a webinar, but please do put in your questions via the chat function. Because I'm hosting this on my own, I'm going to try my best to keep up with questions, but if not, we will respond to questions when we share the video. What we're going to go through today is really looking at why GP-CPCS is so important as a service. We're also going to look at how you claim the £300 engagement payment. We're going to play the virtual outcomes training, and then you'll get the chance to hear from both Zara Safta, who is the program manager in charge of enabling GP-CPCS through London, and Rina Barai, who is one of our PCN leads, who many of you will already know, who will share her experiences of trying to get GP-CPCS off the ground. So first, an update on GP-CPCS, what it is and what it isn't. GP-CPCS is a service much like the NHS 111 referral service, where you can offer a consultation to a patient within your pharmacy. The big difference is that this is a referral from a general practice. So you will be, one, supporting them to manage their patient load. You will be supporting them to stay resilient through coming back through COVID and onwards, and we'll share reasons why. And you'll also be supporting building those relationships across PCNs, which is going to be really important because that's how we see more services coming our way. Now, I know that we've hardly had any 111 referrals. I think the average has been 1 or 2 a month. It's been really, really poor. And we will address this throughout the webinar. But the prize for GP-CPCS, the amount of referrals that can come from general practice, is a lot larger. We already know through the audits that the PSNC has held that every pharmacy is supporting their GP practices through the work that they do already, through the consultations they have that are unrecorded, unpaid, at a rate of 65 appointments a week. Now, this is a way to formalize the work you're already doing really, really well, and to build upon that, to maximize what's really out there and what the potential is for pharmacy to really take on that clinical role in a much more formalized manner and be recognized for it. We plan to support you to get through the rollout of GP-CPCS as an LPC, and to support you as this is going on to ensure that the referrals are appropriate, that they're of a high quality, and that they're coming through the right way. So we're talking to GPs, PCNs, GP federations, the ICS, local commissioners to make it happen. We're also supporting our PCN leads in meetings, which you'll hear about after, as GP practices start to engage with us to really roll out this service. We do plan to support everybody through this, but the rollout is a lot smaller because of the way the service is. It's taken a lot of effort to bring general practice on board. With everything that's happening, it's been a really tough time to roll out a new service like this, but we've had a lot of excitement. There will be IT issues at the GP end and the pharmacy end, and there will be a pack after. There are a number of IT solutions that are available, some which will cost and some which won't, and there are pros and cons for each of them. And you'll be able to go through them with your GPs as you start to embed the service to work out what's going to be best for you. Obviously, as an LPC, we would like to have a single IT solution across Merton, Sutton and Wandsworth, but sometimes it's just not able to happen that way. But we do have more than 5 solutions, all of which can handle managing this service well. We will be hosting virtual outcomes training. We'll be doing that today during the session, and we'll be talking about the other training that's available through virtual outcomes. Now, virtual outcomes, for those of you who already use it, is what I find to be a very, very good online training portal. It's also paid for by the LPC, so able to maximize. We have now got on virtual outcomes training, not just for pharmacies, but the ability for you to share around this service with general practice for them to be able to train their staff so that everybody's getting the same level of training. And released today is also DMS training, not just for us, but for hospital staff, so that we can really start working on that service as well. And we'll be talking to you about the discharge medicine service in the near future. The big thing for tonight is to make sure that all of you as contractors understand and are able to meet the requirements to make the £300 engagement and setup payment via MYS. It's not to be claimed by the 31st of March, that date has changed, so please don't have a heart attack. The date is now the 30th of June, so you do have time to go through the steps and claim the engagement payment. Right, so first things first, how do we claim the £300 engagement payment via MYS? There's a screenshot for MYS for where you go through to claim, and I will talk you through the process. So the first is for contractors to be able to claim the engagement setup payment. What needs to be, will need to happen, as I said, by the 30th of June. So please ignore the 31st of March. The PSNC has sent out guidance recently to say that the date has been extended. First thing you will need to show is that you have participated in discussions with an LPC lead to explore how we might uptake CPCS locally. That's what this webinar is. So the first step is already there if you're on this webinar or if you're watching the webinar because you couldn't attend today. The next step is to have participated in meetings which may be web-based and organised by others to brief pharmacies and potentially general practice on the process that will be implemented. The virtual outcomes training we will show will cover this, and as I said, there's also virtual outcomes training for general practice that you can share with your practices, which will cover it on their side. And where a contractor has no representative available to attend a meeting, they should attend a briefing from us again. So this webinar will be available online. It will be available on our website, and so those that can't attend can watch this in the future. Right. The next step, the contractor must ensure that relevant members of the pharmacy team have read and understood any briefing materials prepared locally by the PCN or delivery partners, for example, the LPC on the referral pathway or any rollout plans. So we will have a document pack that has been created by the LPCs in London together under Pharmacy London. We've had a number of iterations of it, but I feel it's now in a place that's ready to share, which will have a template SOP. It will have training material. It has the CPCS toolkit, the guidance documents for community pharmacy, and the guidance for general practice. What it also has is all the guidance from the CPCS service that we've already been running. So we've put everything in one place. It will be shared via a link to a Google Drive. The link will be on our website, and Sunita will send it out to all of you. We'll also keep you updated on how we're going to roll out these plans. Now, we're going to have further webinars, at least one more webinar on CPCS. But what we want to do is to ensure that everybody that wishes to participate in this service is able to do so. It won't happen straight away because it's quite a tricky service to roll out, but we will be enabling this as quickly as possible in the safest possible manner. Again, it's important as this is being set up that this does come out to all contractors. In the same way that prescription direction is wrong, so is GP CPCS direction. When we're talking to practices about how referrals will come out, patient choice is key. Patients should be able to go to any pharmacy they want to, not the pharmacy they're directed to go to. And all of the meetings we've had so far, you know, our system partners really understand that, and they're actually quite glad to hear that. Right, the next thing that needs to happen is the creation of an action plan for implementing the new referral pathway. So we have in the documents that we'll be sharing a project plan in the form of a Gantt chart and a template SOP that you will be able to work on. Be aware that this is a template. It's up to the contractor to create a SOP that will work for them. But what we've done is we've created a frame for you to develop that SOP within if you choose to use it. Contractor must also ensure that relevant members of the pharmacy team are fully briefed. As this webinar is available online, you will be able to share this with your teams. Okay, so before we get to the training and the main event, I just wanted to say that the service is very much like the NHS 1-1 service. It's not a minor ailment service in a way that we used to have in MSW. It refers patients to community pharmacies as a consultation. So think of it as an extension of a GP consultation. The same thing that would happen in general practice should be happening in pharmacy in terms of how the consultation is run and the quality of the consultation. The patient might not have needed the supply of a medicine, but may only need advice from the pharmacist, which would count. The patient might purchase an OTC med. They might need to be escalated, not back to general practice, but to another service. Or they might need further advice from the pharmacist. It could link to the other services that you're already managing and offering to people coming within your pharmacies. As I said at the beginning, not many people received a lot of NHS 111 referrals. We expect this to be a lot bigger. Now, there are currently 57 million GP consultations for minor illnesses. NHS England have showed varying evidence, but a survey of GPs said that more than 6 or 7% of all consultations could be referred out to community pharmacy. There was another survey taken looking at the actual referrals that happen and the validity of them, and that showed up to 20% of what walks into general practice could be referred to community pharmacy. So this could be a really large number of consultations coming to your pharmacies and could be a huge service moving forward. We need to work together with the system to make this happen. What we want to ensure is that once referring starts, we don't go back to the old methods of signposting. We want general practice to be referring to community pharmacy. We want patients to be self-referring to community pharmacy. I mean, that's where we really want to get to. And we need to make sure, and we are, that whilst we're talking to people, the value is really shared. General practice has a huge target of coming up where they need to refer between 110, they need to have between 110 to 120 consultations per 1,000 patient population. With the workforce they have, that's not going to be managed. They've now come to a point where they really need us to be able to deliver their workload. And we're able to do that. We've shown over the last 2 years that the NHS 111 service has been embedded and it's been running well. It might have been very, very slow, but the referrals that have happened have been very well managed and the feedback has been fantastic. If you know of local GPs who haven't responded to the call out from NHS England or the survey from the RCGP or the BMA, but are really keen to roll out GP CPCS, I'll be happy to join you in a meeting so that we can get started within your patch. I would suggest the first thing you do is talk to your PCN lead and we can take it from there. And please do come to me. As this says, this only works if it comes to a place where it's completely normal for GPs to routinely refer patients. to all their local pharmacies. And we can see it happening because there is no other route. Community pharmacy has stayed open through the pandemic, really shown value. And I think now everybody has realized the value that's added to local patient populations through community pharmacy. IT is the thing that comes up the most. NHS England are not paying for IT in general practice or in pharmacy. What needs to happen is we need an IT model where a receptionist or somebody managing triage, maybe the practice pharmacist, or even through the website, would send a referral to community pharmacy. That can be via NHS Mail, it can be via Pharma Outcomes, it can be via Sonar, or it could be via a new system. The pharmacy would then need to check their inbox, just like you do for other referrals coming in, and then take on the referral, get in contact with the patient. This is a 24-hour service, so you would expect if a patient needed to come and see you and it couldn't be handled on the phone, that video consultation, or you would invite them into the pharmacy within 24 hours of the referral happening. And from there, we would send data back to the GP practice. Now, we're still working through the local SOPs, exactly what general practice wants back in terms of information and the best way to do that. But we will get there. What we need to do with the IT and what we have been doing is talking to PCNs and others. And because of the value of this service to general practice, our first plan is to have the commissioners pay for the IT. Because for the cost of the IT, general practice will see a huge benefit from this. If not, then our next option is to have an NHS Mail type option where there is no cost to community pharmacy or to general practice. Right. Virtual outcomes training is very straightforward. It's 20 minutes long, and it's now provided to all Pharmacy London member LPCs. The virtual outcome screen, when you log in, is very simple. So you type in your F code or your postcode, and it will find your pharmacy. Then you'd search by course name, and you'd go to the NHS Community Pharmacy Consultation Service. Then what you'd need to click on to start the course is the top link, GP referrals team training. All the other links are also really, really good, and I would suggest that when you have time, you go through them as well. They will help you, especially the surgery training. It will help you see exactly what they will be looking at from a surgery point of view, and it will inform your conversations. Right, I will now ask Zara to join us and share her experiences as the program lead for London.
Can you hear me?
Yes.
Okay, so you can't see me because I don't know how to put my video on.
You're okay. We can see a picture.
Okay, we do have Dragon Ball Z.
That's the one.
Okay, I don't know how to put that on, so I will leave that as that is. Hi everyone, so my name is Zara Safdar. I am the London Implementation Lead for GP CPCS. And for those that have been around for a few years, I used to lead on community pharmacy education for Health Education England about 5 years ago. So we've been, I started the role in December, a couple of days a week, which is probably the worst time ever to start because it was in the middle of general practice, really gearing up to start the vaccination program. And it was holiday period and we were going into lockdown 3, so the timing wasn't ideal. However, since then, we sent a survey out to all our general practices, asking them if they wanted to be what we called early adopters. And I think that wording is really useful to understand, because when you're speaking to your GP colleagues, it is really important that you remind them that what they're signing up for is something which is a already commissioned service. It's not something that's new, it's already out there. So they have the faith that we're not piloting anything with them. The data, the evaluation, all those things already exist for us to fall back on in terms of how many referrals are done, what you're seeing on a daily basis in terms of referrals, etc. So just following that journey through, we sent the survey out. We had lots of really great interest across Southwest London. I then went on to work with the LPCs to match up the practices and the pharmacies together. And we did what we called initiation meetings. And there was a reason they were called, the word initiation was used. It was to really allow both parties to understand that they're now going to mobilize a service. So we went to all these initiation meetings. I mean, to be fair, in Southwest London, there was so much interest, and I'm not just saying that because I'm on this meeting, but it genuinely was the most out of the whole of London. We had to do a meeting per borough, whereas in other areas we kind of got away with doing some per LPC. The meetings, all of them, Amit kindly came to all of them with me, and we had GP colleagues plus community pharmacy colleagues. So really great collaboration in every single one. You get my learning from it is you get the usual challenges, and as long as you can answer some of those usual challenges, there's very few people that can walk away from that meeting not agreeing that this is a service that they want to implement as soon as possible. So as long as you can overcome those challenges, I'm happy to take any questions on the chat, and I'll probably leave my role is ending in a couple of days. So Amit managed to get this webinar in just in time, but I will leave a lessons learned. So, I mean, the top things that come up are IT, which Amit's kind of gone through with you. My line with the GPs in terms of IT is the solution will come like any digital solution. It will follow. I mean, we live in a world where digital feels like it changes by the hour at the moment. But actually, let's just don't let the digital be a barrier. Just you can kind of keep going with the NHS mail. Might not be ideal, I know, but you can it's something to start off with. So IT comes up, you get the very usual questions about what's the difference between this and signposting. As long as you're able to explain the whole referral pathway, questions around receptionist training, which the LPC and the training hubs locally will support you with in Southwest London. For me, the biggest lesson learned from all of these meetings has been that actually everyone is on the same page. So start the meeting off with getting the challenges and barriers out the way. And by the end of the hour, I promise you they've forgotten them. But the most important bit is getting that date out of your GPs of when they want to do a soft launch. And I think if you can do that, roughly, I think 4 weeks works to keep the momentum going between you and your practice colleagues. Shall I pause there, Amit? I don't know if you have any questions. I'm also conscious you can't see my face, which I've tried to fix while I'm talking.
Thanks, Sarah. We have no questions in the chat.
So yes, that's me. I mean, I'm going to leave everything with Amit. If anyone does have anything, I think Amit, feel free to share my email address. NHS England will still support contractors with this, but overall, it has been a really positive experience. Like I said, in and around London, I think I did close to 25 meetings in a period of 2 to 3 weeks, which is a lot of hours, but I'm yet to walk out of one with them not giving me a date when they wanted to soft launch it. So I suppose my message to everyone is they do want to do it. You just have to handhold them through the process of doing it. And yes, the first 3-4 weeks will feel tough. Trying to mobilize any service is tough. But once you've done that first bit, the lessons from the early adopters are you're seeing on average, 60, 70 referrals a week from an average size practice of 8 to 10,000 patients. That's a lot of referrals. And that slowly builds up over 6 weeks. So by week 6, 50 to 60 referrals. So yeah, anything you need from me, just let me know.
Thank you, Zara. Thank you for offering to share your email. I'm sure people will take you up on that. We have a question asking, how did GPs feel about using NHS Mail for referrals?
So they were okay. So in the GP system in Southwest London, we have EMIS, and Southwest London CCG pay for something called Ardens, which is an inbuilt template. So they don't have to physically fill out a Word document. They fill out what's called an integrated template. So the patient phones, you enter Mrs. Smith's date of birth, you click on referral template, and the template half populates. So they still have to email it, but it's not as itty bitty as it sounds in terms of a referral Word document. And to be fair, they were all absolutely fine. They knew that the IT solution will come, it will come in the background. But if I tell you that the IT solution is going to come in 3 months, by that point, you would have done 200 referrals. That's 200 appointments saved. So as soon as I tell them those kind of numbers, they're like, yeah, well, actually, we'll just get on with it on email.
Thank you, Zara. We have another question which will lead us into the next part of this webinar. Reg, thank you for asking. Do you think it would be worth approaching as a PCN group, or is it more effective by individual pharmacies to a general practice? I would definitely say it's worth approaching as a PCN group. As someone leading the LPC, I think we need to do this through our PCN groupings. It will be PCNs that will work with us rather than individual general practices, and this is how it will grow. And on that, Amish, I will come back to your question around the average number of referrals an established pharmacy would receive. Actually, Zara, if you'd like to answer that question, what is the average number of referrals an established pharmacy would receive per month? So from what we've seen elsewhere, and I will join Rena onto our panel, who will talk us through her perspective as a PCN lead, trying to get this going in her patch.
So Amish, I can only tell you from what's happened in London so far and what I've seen happen in other parts of the country. If for a practice size of about 8,000, they were, by the end of the pilot, they were seeing, I think, 15 to 20 a day. That was by the end of the pilot. And then bear in mind, the pilot was pre-COVID. It was before patients were used to seeing other healthcare professionals. I think it is a very different world post-COVID. So that was then, and that wasn't London. Bear in mind, we had no pilots in London, so it's very difficult to make that judgment. Of course, I'd be expecting higher numbers in London.
So would I. And Amish, you're right, that is a lot. Like I said at the beginning, the opportunity here is huge if we get this right. And that's why we think as an LPC, it's so important to support you through this. Rena, if you would like to join us, and I will leave you to introduce yourself because I don't want to miss anything out with all the roles you have now.
I'll keep it simple because I appreciate it's nearly 9 o'clock and we've all been at work today. My name is Rena. I'm an independent contractor in Sutton, but I'm also a primary care network community pharmacy lead for Achievement South Sutton. But nationally, I'm on the development and implementation group for CPCS as a PSNC committee member. Hence why I've been really interested to see the rollout of this locally, because this is very different to sort of other services. This is very much about creating those local relationships and getting implementation bottom up. So using the relationships we've all got with our local GP practices and PCN leads, and actually working so much more collaboratively with the contractors around us as PCN leads as well. This is going to be a lot easier to kind of get off the ground from our point of view. Just to share my quick bits of experience, when I approached my GPs within my PCN about this, I think their words were, gosh, Rena, this sounds like a no-brainer. And it was really interesting, and it is, as Zara and Amit have both said, about how you sell it. And GPs are very used to referring patients to lots of different places, podiatry for feet, for example, musculoskeletal for joint issues. So this is no different to refer pharmacists for minor illnesses. I think some of the barriers that I've come across when we had that first meeting was about confidence levels of some of the reception staff. And the GPs had some concerns that this was like a reception staff being made to triage patients, and obviously they're not medically trained to triage. So there was a kind of change in wording that we've had to use, and it's about streaming patients as opposed to triaging, and making sure that there's an appropriate referral process in place locally. So if you are PCN leads, or if you're interested in setting up this service, please do speak to your PCN lead, because I think what you need to do locally is to have these meetings, as Sarah's arranged for us for the early adopter sites, where you sort of discuss who's going to be kind of leading it, how you're going to have the referral process, how the streaming will work, what the IT solutions are, how it will work at a pharmacy, and what the escalation routes are back in case of any issues. So these are the main kind of key priority areas that you really, really need to work on. But I think, as everyone has said tonight, this is a really, really good opportunity for community pharmacists to show, their clinical knowledge, their skills. We are experts in dealing with minor illness. And we've really got to get it right the first time. So take your time to get this off the ground, implemented locally, and use the support that the LPC is offering to make this happen locally. And I think nationally there have been some really great pilots which have shown that this works really, really well, with pharmacies receiving lots of referrals. And obviously our patients are going to love it as well, aren't they? Because they'll see a different side of us now, won't they, as well? You coming to see us, doctors referring their patient to us for our expertise, which I think can only be good for pharmacists, can't it? And again, I'm happy to take any questions later on, or if anybody wants to get in touch with me, I'm sure Amit will share my details as well, just to pick my brains on how this is working locally.
Thank you, Rena, and again, thank you for agreeing to share your details. I think it'll be really useful. Well, so that's the end of our webinar. I haven't had any more questions in the chat panel. We'll wait for another minute whilst I summarize. If there are any questions, we're happy to respond to them now. If you have any questions, please do get in touch with the LPC. More than happy to help. And as Zara and Rena have so generously said we could share their details as well, I will do. Just to summarize, if you follow the steps from the beginning of the webinar, from Annex F of the toolkit, you will be able to you'll be able to claim the £300 engagement payment for GP CPCS. Any further questions about that, please do get in contact with me. Please share the training with your staff and do the training yourself. Especially please look at the other parts of virtual outcomes. It's a very useful tool. The webinar will be shared online on our website, and we will share a link through an email which Sunita will send to you. We will also share a whole range of documents that will help you through this. We're here to help, and to further the help that we provide you as an LPC, I will also be sharing details from next Friday of a Friday clinic we'll be holding on Zoom for an hour every Friday in the daytime, because I don't want to take away from your Friday evening, where you will be able to join at any time during the hour to ask any questions or share anything, or talk about any improvements you'd like to see from the LPC, because we want to be able to support you as best as we can. There will be more webinars to come, and we'll be next talking about the discharge medicine service. We'll also have a further webinar about GP CPCS. And as we start to come into the new financial year, we'll be talking about the new reappointment of public health services and how we're working with them. We have a couple more questions. So just before I close, we'll go through them. Okay. So we've got one question. Who's made the most progress? Any PCNs had any success in South West London, or are all at ground zero? So far in London, actually, Zara, let you answer that. Where are we?
So far in South West London, they've all got go live dates for a couple of the Sutton and Wandsworth wanted to go live this week. So by go live, I mean do a soft launch. I suppose I just want to emphasize that by going live, you don't have to go all in and say every single minor illness will now come to pharmacy. You can do what you would call a soft launch. So we're hoping to see some of the soft launch stroke tests with Sutton and Wandsworth this week. Otherwise, all the other areas, so Kingston, Merton, Richmond, we're all hoping for the week after bank holiday weekend to do some soft launches. So nothing, we haven't had any live referrals in Southwest London yet, but we have in other parts of London.
Emily is asking, how do we ensure red flag referrals are followed through, i.e. patient visits, A&E is signposted? So you would be using the same process as you currently use for the 111 service, and flagging it forward as appropriate. We will be helping you work that through in your SOPs as you start to develop them. Rena, have I missed anything out in response to that question in terms of red flags?
No, I don't think so. I think, you know, if there's a patient that you are worried about, it's about your communication skills and how you make sure they do visit A&E, if that's what you feel it is necessary for that patient, making sure you fed that back to the GP with the sonar referral back
Thank you.
of your assessment, obviously, as well, to make sure you've documented that you've advised that patient visits A&E. You know, you can't physically take the patient to A&E yourself, but that's like every patient that we say, but just make sure your documentation is appropriate and you've used the right consultation skills to stress to the patient how important it is they visit.
Amish, what happens if the PCN lead does not respond? As part of the toolkit, there's also a draft email to send to the practices and the PCN lead, well, the PCN clinical director. If that doesn't work, I'm more than happy to send an email myself to see if that will help you, or to pick up the phone with neighbouring PCN clinical directors to see if they can help influence. The NPA have issued a comprehensive list of red flags as a training tool. Thank you, Catherine. Okay, and
there was one question, sorry, further up about training will be key for this, otherwise standards of consultations will vary. So please do make the most of the current RPS training that's available. It's in conjunction with RCGP. So if you didn't do the CPP training last year for CPCS, then it is live at the moment, and they're all online webinars which are easy to do in your own time, just to make sure that you do, you know, go through the right history taking and making sure you ask all the right questions so that you're covering your backs if you are worried, and that we can all offer the same sort of standard of consultation for the service.
great, thank you, Rena, for sharing that. And absolutely, the RPS training won't be available forever, so please take it up as quick as you can. I do recommend it. Thank you, Rena and Zara, for joining the panel tonight and supporting us to share this. And thank you, everyone, for taking time out on your Monday evening and joining us. I hope you have a safe week. I hope you have a good week. Enjoy the sunshine. Take care all.
Thanks, Amit.
Bye, everyone.